Hi, this is Dr. Paul. So let's talk about PTSD, post-traumatic stress disorder. It's a very common thing I see in my practice. I work with some people who work with veterans, so I see a lot of veterans, especially Vietnam veterans, Iraq, Afghanistan veterans. So that's maybe the classic PTSD is from being in the war, witnessing horrific events, and I have some patients just what they've gone through is it just makes you cringe, and actually it's sometimes brought me to tears when I hear what they've gone through because it's just so horrible and what they've seen and witnessed and just shocks us. It shocks the conscience. But it's not just them. There's also a lot of other reasons for PTSD. Being a victim of rape, being a victim of a crime, being a victim, like fearing for your life, like thinking you're going to die, like a near-death experience, or there's a lot of different things that can cause it. The death of somebody that's close to you, witnessing a crime too can set it off. Trauma from the past. I mean, probably the most difficult and the worst I probably see is the victim of sexual abuse, especially as a child. Or a child adolescent, so basically a victim of, from a pedophile. So that's something that really cuts deep. That kind of trauma is very difficult to get through. Even as life passes, it's very difficult to get over that one. But also victims when they're having bad parents, having parents who are physically abusive, emotionally abusive, neglectful. So there's a lot of different reasons why people have PTSD. It's something also that's treatable, and so the best treatment, I mean, seeing a therapist is important for this one, but there's a specific therapy called EMDR. It's like eye movement, something. I can't remember exactly what it stands for, but EMDR, where it's just basically it's difficult because you have to relive the experience, but it's in a way to get through it and get to the other side. So you have to go to a therapist that's trained to do it. But I've seen some pretty remarkable results with some people who've had really tough PTSD. And it's sometimes you have to do that therapy for a while, but it's more effective than the typical like cognitive behavioral therapy or the most common types of therapies. So it's a specific one for trauma. Where I come in is with treating it with medications. And now treating it basically is very similar to treating depression and anxiety. It's basically the basics. So we always have to look at when you look at the nervous system, which functions by nerve cells constantly communicating and connecting, so when you get to the level of the cell and the synapse, I focus on serotonin, norepinephrine, dopamine, and GABA. So I call the big four, and they should be going forward, not backward. Okay, that's a healthy system. But what PTSD does, and especially, I mean, again, let's say someone has PTSD, but they also have other reasons for these imbalances. Maybe say they have underlying anxiety and depression prior to the PTSD, or so you might have a mixture of things. But the key is treating it properly. And so you always have to look at the two basics: serotonin, norepinephrine. I don't know if I know another doctor who believes that the SNRIs, so the medications that balance serotonin and norepinephrine at the same time and get these chemicals moving forward, is better than the SSRIs alone, because SSRIs alone, sometimes they're not as effective. They can cause feelings of apathy, fatigue, sexual side effects, And so when you balance also norepinephrine and not just serotonin, it helps take away those side effects. It helps better with anxiety than SSRIs. It also helps with physical symptoms like muscle tension and pain, and so that's why they're better. Now, let's say they don't work. Okay, well, if it's not that, maybe we look at dopamine. But normally, one of those two is helpful. Most likely, an SNRI. My favorite is Prestique. There's also my second favorite is Effexor XR, and there's also Cymbalta. Wellbutrin can help, like the depression associated with, when you boost dopamine forward, and a little bit norepinephrine also, but not a lot. Then that can help with the depression, the motivation, the energy. Take away if there's any sexual side effects from the first one, it can take that away. So typically treating basically these things is fairly easy. It doesn't take away the trauma, but when you balance the chemicals, it really helps the residual, like the depression, the anxiety, the other things that are associated with the PTSD. It helps those symptoms. And so anyways, it's just basically when it comes to treatment, it's really, you look at the individual, and you basically follow the same formula, the Corona protocol formula that I do with other things, along with the correct therapy. But the good news is it's treatable. I've seen it's really satisfying when I see a veteran who has been suffering for 50 years, okay, and comes and sees me. And within a visit or two, I get rid of the nightmares and insomnia. I get rid of the flashbacks. I get rid of the anxiety, the depression. And within one or two or three at the most visits, I'm able to turn that person's life around. And they say, I haven't felt this good since before the war. So it's really exciting when I see a patient who's risked their life and served our country admirably, and then they're suffering for so many years, and so the rest of their life, even they're often in their 70s, or some of the people from Korea are in their 80s, the Korean War. But when I see that, and I realize the rest of their lives they're going to feel better now. They're not going to have to suffer the same. And some of them say even the memories, I don't think about it as much. I don't I'm thinking so much more positively now. I don't dwell on that as much anymore. So it's really satisfying when I see that happening. So if you want to learn more about PTSD, in my book, in my newest book, The Corona Protocol, chapter 5 is on PTSD, and I tell the story of a man who was in the Vietnam War, and I tell his story and the treatment. So if you want to learn more, I really recommend getting my new book, The Corona Protocol.